Hello, everyone. I'm Tammy York Day, President and CEO of the Louisville Healthcare CEO Council, a founding partner of the Co-Immunity Project with the University of Louisville Christina Lee Brown Envirome Institute. Thank you for joining us and for recognizing the importance and incredibly innovative nature of all this ongoing work to keep our communities safe as possible from COVID-19 through research and data. As a reminder, the Co-Immunity Project is a collaborative project originally announced in April by Governor Beshear. Phase 1 of our project involved comprehensive testing of our frontline healthcare workers, and a study of our partners on Phase 1 included Louisville's major hospital groups of Norton Baptist and UofL Health and others. Results of that are going to be out very soon. Going forward into the next phase, our partnership will extend to residents themselves in every part of this city. Dr. Aruni Bhatnagar will discuss the details of that just a little bit later this morning. But first, I want to hand it over to a great leader in our city to share some exciting news about our project. I'm so pleased to introduce my friend, the incomparable president of the University of Louisville, Dr. Neeli Bendapudi.
Thank you, Tammy. What wonderful and gracious words. I appreciate it very much, my friend. First of all, thanks to you. Thank you, because we are so very proud to partner with you and the Louisville Healthcare CEO Council. And we so appreciate the opportunity to bring private sector partners to work with us, and certainly the hospital leadership that you mentioned, without whom phase 1 would not have been possible. This project is really a true expression of the promise of our Christina Lee Brown Envirome Institute. And everybody, this is what we call the circle of health and harmony. And Christina Lee Brown, the vision of the Envirome Institute, and her vision also, is that we really need to look at health in a holistic way. So that doesn't just mean all aspects of health: physical, mental, financial, spiritual, but also that we need to be holistic in our approach, which means that all members of the community need to be participating. And that's really the genesis and the inspiration behind this Co-Immunity project as well. The number one request that I have for all of you who are listening and who may be writing about it, talking about this, is please, please, please encourage people to participate when they get an envelope in the mail that invites them to participate in this project. It will have the University of Louisville logo on it, so please do participate. And now, it's my pleasure to share some really exciting news about the Co-Immunity Project. This is a special day for the University of Louisville to recognize a partner who is helping to make this whole enterprise possible. So today, it's my pleasure and great honor to announce that the James Graham Brown Foundation has committed to a $1.5 million pledge to support phase 2 of the Co-Immunity Project. And yes, you may all applaud. This is great news for us. The gift, this really incredible gift, will allow us to fully implement the second phase in Jefferson County. It will also really position us, because our goal is to expand and replicate this project all across the Commonwealth. And this gift will make that possible. Now, why else is this a very significant day in the life of the University of Louisville? Well, to receive the gift from the James Graham Brown Foundation is a special thing. As you all know, this foundation is not just the largest in Louisville. They have a long record of commitment to equity. At a time when this is so much at front and center for so many of us, we are so thankful to the James Graham Brown Foundation. There's another thing that's very special about this gift. So my thanks to the entire board of directors for making this possible. You see, the James Graham Brown Foundation, in my mind, when they give you a gift, it's like the Good Housekeeping Seal of Approval or the Better Business Bureau, because this is a very sophisticated, caring group that does their assessment and choose wisely. This is the first new gift of this magnitude to the University of Louisville from the James Graham Brown Foundation in about 8 years. So we are very, very grateful. And this is a team that likes to work together. just like Tammy York Day said, I think the words were incomparable. So I'm going to stick with that theme. And now it's my pleasure to introduce my friend and a friend to so many in this community, the incomparable Mason Ruffle. Mason?
Gosh, thank you, Neely. Very, very kind words. Well, it's a pleasure to be here and an honor to represent the foundation in this project that has such promising implications for Louisville and our state and our country. And as we all know, this pandemic has been especially difficult because of what we don't know about it. Despite the many efforts to understand how it behaves and how it affects our communities, there is much to learn. And the benefits of this project depend on this being understood throughout all of our communities in Kentucky, and not just right here at home. This is what appealed to us about this project. It has inclusiveness at its core, as all neighborhoods of Louisville will be represented, and it has such great potential to help us mitigate the long-term effects of the virus by collecting the data to help reopen our economy safely. Our physical and economic health depend on it. The Brown Foundation exists to improve the image of Louisville and Kentucky, to improve our quality of life, and to do so with equity. The Co-Immunity Project and the Christina Lee Brown Envirome Institute are doing just that, so we appreciate the opportunity to partner with them, and our hope is that this will be a model for the nation. And finally, it is particularly gratifying to work with the University of Louisville again, and we look forward to promising outcomes that will benefit all of our communities in very crucial ways. So thank you.
Thank you so much, Mason. You know, I think we've got such a great community. And, you know, as I said earlier, Dr. Aruni Bhatnagar will walk us through phase 2 of this project. And I'm just so proud to be a part of this groundbreaking work and the strong collaborative effort that has made it possible in our community. So thank you so much for this gift. This collaboration includes you, the people of Jefferson County. That's why we're so excited about this announcement. The Co-Immunity Project is going to be sending out invitations for residents to participate. Dr. Bhatnagar is going to be talking about that in just a minute. And this will get you a free test if you have the COVID-19 antibodies or the active virus. And it will give our researchers the data they need without your name being attached to it, meaning that you'll be anonymous. And as Aruni will explain, you'll be doing your part in helping keep all of us safe. So now over to you, Dr. Bhatnagar.
Thank you, Tammy. I agree that this is an important project, and it is an initiative, an ongoing commitment of our university as Kentucky's Metropolitan Research University. As you know, the project was announced by the governor in April. And since then, we've been busy working and developing and expanding our testing capabilities. And as you pointed out, Tammy, last month we completed the first phase of the project. In this phase, we tested the healthcare workers for the active coronavirus infection, as well as for antibodies, which are indicators of past infection. The healthcare workers are, as you know, an important sector of society, and the dedication and their commitment to their work during this pandemic has drawn worldwide acclaim. Therefore, to ensure their safety and the safety of our patients, we tested nearly 1,500 healthcare workers at UofL, and we will be announcing those results soon. But today, I'm pleased to join you in celebrating the official launch of the second phase of the Co-Immunity Project. In this phase, we will test for COVID-19 in the general community, but in a very different way than it's been done to this point. Although there are many sites where those who want can get tested, that only tells us about those people and not the general population. There are many people who never had symptoms, or who mistook this virus for something else, or who just wrote out the virus without being tested. Testing only those who are concerned about their health, or those who have symptoms, or those who have the means to get tested will not tell us about the true extent of the virus in our community. For this, we need not only expanded testing, but smart and consistent testing. We need to test a random sample of people who are representative of the entire community. Much like a well-designed political poll, we have to be careful to ensure that the test results from a group of people mirror that of the larger population. Only this can give us a real picture of who has the virus and who has had the virus. Therefore, we are planning to test a wide swath of people who live in Jefferson County to see how widespread the virus is, how widespread the antibody is, and whether the rates of infections are increasing or decreasing in our city. For this, we have mailed invitation letters to about 13,000 households to participate in the study. But to ensure equal representation in the first round, we will enroll about 2,400 individuals of different age, sex, and race who live throughout Jefferson County. Such an inclusive testing plan was developed to uniformly cover all parts of the city, and it is required to assess the true extent of the spread of the virus within our community. Because you will repeat this testing every 8 weeks, we will have repeated and consistent results from the same areas. We may also have early warning in case the virus infections increase again in the fall. And it is our hope that through this type of regular representative testing that we will be able to calibrate our response with greater precision in risk group, in timing, and in location. At the Center of Predictive Medicine for Biodefense and Emerging Infectious Diseases at UofL, we have some of the best facilities in the world for working with infectious agents. We have tested our methods and we have validated our procedures. And we have conducted multiple trials to troubleshoot potential problems. Moreover, to make sure that our sampling procedures are appropriate, we are partnering with Westad, which is a company that conducts major national surveys for the CDC and other federal agencies, as well as businesses, foundations, and state and local governments. But to succeed, we depend upon the participation of our community. As I said earlier, last week we mailed the first batch of letters and to people all over the city. And these letters, graciously signed by Dr. Bender Pudi, are to invite people to come to our testing sites to participate in the study. If I can take just one moment to share our the letter that we have that's sent out to everyone. You could see that it will have a seal or the logo of the University of Louisville so that you know where it is coming from. So if you receive the letter, please register as indicated in the letter. Finally, none of this will be possible without the generous support of our community partners. Our work with the healthcare workers was supported by the Jewish Heritage Fund for Excellence. And now this generous leadership gift from the James Graham Brown Foundation will kickstart our community testing activities. So we are truly grateful to you, Mason, and your board for the support and recognition of the importance of the high quality information that is inclusive of all our community when our community's health and well-being are at stake. The project is a national model, and we hope the rest of the country will follow in the coming months. Your generosity reiterates your belief in our mission and reaffirms our commitment and your commitment to the health and the well-being of the citizens of the city of Louisville. So thank you very much.
We will accept questions submitted via the YouTube video. So that might take just a moment to come through. I'm not seeing any questions come through. Some people say that it's amazing news. Go Cards. Thank you, J. Graham Brown Foundation. So we're very happy. A question, Dr. Bhatnagar, perhaps when will we start learning results from different phases of the testing?
So the first phase, as I mentioned, is complete. So I think we are going to be able to announce the results this week. And for the second phase, since it'll take us till the 20th of June to finish, then I am hoping that within 10 to 12 days that we should have at least results from the first round of these phase 2.
Thank you. Also about Dr. Bhatnagar, where will the testing sites be?
So we are still in the process of finalizing them. There will be 3 testing sites. One would be at the downtown site where the University of Louisville testing already is in progress. We will share those capabilities with the university hospital and work with them. The second site would be in the east, and the third site would be, I think, at this at the St. Mary Elizabeth Hospital. And we will sort of direct people when they get the invitation. If they respond, we will give them a date and a time to go there so that they would know which site to go to and what times to come.
Okay, thank you. Okay, one final call for questions. Here's a question. Because Louisville is urban, can the findings from these results be used in rural areas at all? Dr. B?
Yes, so that is always a tricky issue. We know Louisville is urban, but it is also a very different in different parts of the city. So to understand how the virus is spreading in different parts, you divide the city into 8 different zones. But most of those zones are also quite urban, but some of them may have some rural components. So we think that it would be somewhat precarious to extrapolate our results from urban areas to rural areas. So I think if this model could be followed in the entire state of Kentucky, then we would in the future like to include both urban and rural locations.
Very good. Another question, how much funding is still needed for this project?
Well, so we have this project rolled out in phases. So we have enough funding to do the first 2 and maybe 3 phases, but then we would need enough funding to continue on into the future because we want to do this every 8 weeks and we want to create sort of a constant monitoring setup. So even if the virus we find is low in some communities, it may reappear. So we do have funding to go through the first 3 rounds, and then after that we need additional funding.
Okay, thank you. And one last call for questions. Why is this study nationally significant?
So although people have been testing extensively, we think that because it's convenient sampling and it is not systematic, it's very difficult to estimate what is the true sort of incidence of this virus, how many people are infected. You may have seen in the news that people say that, oh, there are a number of cases in this location increase, but that increase may be just because there's increased testing. Now, if we do randomized testing, we do not have this problem because then we have taken into account different places, different people. And so if there are changes that happen, that would reflect true incidence of the disease. Unfortunately, we do not have that data for the entire country or even for most states. So we do not know how many people in that entire region are infected. And that's important not only to know the infection, but also to know fatality rates. So we do not know whether in the United States or in Europe that how many people actually got infected and how many people actually died from it and how many people got sick. And all of this can only be sort of attempted or to address when we have randomized testing. So I think if we do this in Louisville in a small sort of area, then if we succeed in doing it well, and that we do indeed have a good grasp of how many people are indeed infected and where, then that could be then sort of used as a model nationwide, because we do desperately need that data in order to evaluate what's happening with the virus and to understand how widespread it is and what its true lethality is.
All righty. All right, I don't see any more questions. Thank you everyone for submitting questions. If you do find you have additional questions at a later point, you're welcome to email us or comment on the video. It will be posted at a later time. I also will have a slightly cleaner video available with a link later. Okay, one more question. what if we do not receive a letter? Can we still volunteer?
So in order to ensure participation with everyone, we could, we want to send out letters so that we only invite the people who are in, we would cover up the whole area of the city. There we have a site that you could go and express your interest in the project. And then when we do the next round of testing, we can invite you.
One more question we have, how does this project contribute to the Envirome's mission of creating a new vision of health?
So as Neely pointed out, a vision of health that is the guiding mission for the Envirome Institute is a holistic view of health. Health is not simply sort of a physical health of an individual, but how an individual exists in the society. So you have mental health and economic health, cultural health. So in order for any one person to be healthy, we have to relate that to the health of the entire community. And what this pandemic has shown more starkly than any other event before, at least in our lifetimes, that how our health is connected to the health of everyone else. And so we think that this new vision of health that we have been trying to develop, which is to look at health as part of our social shared experience, has been brought to stark relief by this pandemic. And so we thought that it is imperative for us to examine how the health of a community is affecting the health of individuals, and what does the environment mean in terms of the transmission of the virus, in terms of the lethality of the virus, and in terms of all the socioeconomic sort of factors that govern our health and well-being. So working on this project is an extension of the idea of a new vision of health, which is inclusive of different dimensions of health of individuals and communities together.
Very good, thank you. I believe that is all of our questions. Again, if anyone has additional questions, please feel free to reach out. We will post a video for the media shortly. And thank you to everyone for participating today.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
Thank you.